Dr. Alice Chen is here. She is the executive director of Doctors for America. She's a practicing internal medicine hospitalist and an assistant clinical professor at UCLA. DRS4America.org, as in Doctors for America, FOR America.org is the website. And Dr. Chen, welcome. It's nice to have you with us.
Thanks, Tom. It's
nice
great
to meet
be
you.
Here.
Tell me about yourself and about your organization.
Sure. So I'm a doctor. I take care of patients, and at some point when I was taking care of patients, I realized that too many of them couldn't get the care they needed, so I became a part of this organization of thousands of doctors and medical students across the country who believe that we need to put patients over politics and make sure everyone has access to health care.
That is great. Doctors for America, when did it start? Where is it based? What do you all do?
Sure. So Doctors for America was started in 2009, and we have 16,000 doctors and medical students in all 50 states.
Really?
Exactly.
Wow. What kind of membership does the AMA have?
It's around
like
200 or something.
Oh, it's 200,000.
Yeah.
Oh,
yeah.
Okay. All right. So there's a lot more doctors than I realized.
There are a lot of us.
Yeah.
But we have 16,000 active doctors who are working to try to get our patients the care they need.
That is spectacular. And what are the principal areas that you're working in? What do you see as the pressure points that are worthy of effort to produce the kind of results that you're trying to achieve?
So certainly having access to health insurance is a really important one, which is why we're here at the Supreme Court, why we're bringing in doctors from around the country, or they're coming in on their own to be at the Supreme Court and make sure that people keep the insurance that they...
So you're getting ready for tomorrow for the oral arguments in King v. Burwell.
Exactly.
Yeah.
Exactly.
And go ahead.
We just thinking about the fact that 8 million people's health insurance is at risk.
Yeah.
We can't let that happen.
Yeah. In fact, the latest, I was just looking at the Think Progress website, and I think the latest number that they were talking about, they have this, the numbers that explain Obamacare and what would happen, and it's really pretty startling. 34 states will be left scrambling. 13 million Americans will lose access to health insurance, according to them. Mm-hmm. Premiums could increase up to 774%. Mm-hmm. 8 million more Americans go uninsured. 71% of people already disagree with the Supreme Court doing this. This is nuts. This is how not only has partisan politics contaminated by corporate interest devastated our legislative branches in both the federal and state houses all over the country, in my opinion, as a result of a series of Supreme Court decisions over the last 40 years saying that money is protected by the First Amendment of the Constitution. Oof. And, not only is that happening, but it's like the Supreme Court now has become politically corrupted. I cannot find, I've read this argument, and I cannot find any rational legal basis for it.
Exactly. And you ask Democrats and Republicans alike, and in these 34 states that didn't set up their own exchanges, nobody thought that they couldn't get tax credits.
Right. And some of them try. Oregon set up an exchange, and they just hired the wrong company to do it, and it didn't work all that well. And they said, forget it. We'll go with the national exchange. But this is it's really quite extraordinary. Does Doctors for America have any specific policy prescriptions, or are you're right now you're just fighting to King v. Burwell, basically?
Well, we're fighting King v. Burwell. We're also trying to make sure that all those states that have not expanded Medicaid, that they expand Medicaid.
How many are there now?
There are, 28 states have done it. So
that would be 32 that haven't, or no?
22.
22. Yeah, you do math better than me. So 22 states. So we've got
math on the fly.
There you go. So it's good for titration and things. So we've got 22 states where people still can go bankrupt because they get sick, where they, and these are almost exclusively working people, because in those 22 states, if you're not working, you actually qualify for state-based Medicaid if you're genuinely poor and have no income. But as soon as you make over $3,000 or $4,000 a year, you're no longer eligible for the state Medicaid, and you're making too little for the Obamacare sub. This is the damage that John Roberts did to Obamacare the last time the Supreme Court heard this case.
Exactly. Enough is enough.
Yeah.
We need to get people care.
I agree. Well said. So is Doctors for America presenting at the Supreme Court tomorrow, or are you just presenting it not just, are you presenting in front of the Supreme Court?
In front of the Supreme Court.
That's
We
great.
are going to be there in our white coats to speak on behalf of our patients who couldn't be here.
That is marvelous. We're talking with Dr. Alice Chen, the Executive Director of Doctors for America. The website is drsforamerica.org. And what do you think is the status of single payer in the United States right now?
I think we're pretty far off from it.
Yeah.
I mean, just look at what's happening with the Affordable Care Act, which is it's a much milder version.
Oh yeah, it's basically what Richard Nixon proposed in 1971. I mean,
Exactly.
it's an old Republican idea actually, which is so strange. I mean, it's what Mitt Romney did in Massachusetts.
Exactly.
Oh my. So, on the other hand, if the Supreme Court takes out Obamacare, does that open an opportunity? I mean, the country has been listening to this conversation for a long time. The majority of Americans, 71% of Americans, think the Supreme Court should not destroy Obamacare. That would imply some support for the idea of national health care.
You know, honestly, I don't think it's worth risking. Because
Yeah.
somebody who has cancer and is on chemotherapy is going to lose their health insurance and they're going to die.
Yeah.
And I'm just not willing to take that risk.
Right. Or somebody who's got a family member that gets sick or even just gets in a car accident and they don't have insurance and they may not die, but they may be paying for it for the rest of their lives. They may be
Exactly.
bankrupt. They may lose their jobs. They may lose their homes. I had a fascinating moment. I was in Denmark. We did this show from Copenhagen a couple of years ago, and I had the head right-wing politician, the most conservative politician from the parliament on. And I said, so you're a conservative? He's like, yeah, I'm a conservative. I said, so that means you want to do away with the Danish national healthcare system? And he said, what, are you crazy? I was like, I couldn't find a single, conservative there meant that they were against immigrants. I mean, that was pretty much it, It was amazing. Anyhow, Alice Chen, you're doing God's work. Thanks so much for dropping by.
Thank you so much,
Very
Tom.
nice to meet you.
Likewise.
And the website, check it out, please. DRS, as in doctors, for F-O-R, America, Doctors for America, DRS for America.org. Got it right?
Yep.
Great.
Exactly.
Thank you.